Tina, check whatever comes on our YouTube. Okay. Got it. Now, what are you showing?
So they are supposed to show.
Did you post it?
The screen.
The map has paused.
Have you? That's post.
What's this?
Sign in if you have been granted access.
So, but then we're all of our infectious disease programs that are. So, our team. We all wear 70%.
How about YouTube? We are good. We are active. Productive. Live streaming.
Is it there?
It's on live.
Yeah, but you see, when we went to public, it tell us to sign in again.
Give me the password again. Okay. They're live. Okay, so now you're supposed to do that.
So what?
Whatever is displaying here is what's supposed to come on YouTube. But now, what is going on YouTube? Let's see. We don't get it. Okay, now I see.
Yeah.
What do you think?
I was trying to.
So let's follow up.
Where's the Steve?
It's on the podium.
Yeah, we talked yesterday.
Yes, ma'am.
That I was supposed to.
Okay. They're behind.
Are you gonna be around, Jeff Francis? Are you gonna be around? You're gonna sit there or what?
Yeah, I'll be around.
Because what you must do is just.
Yeah, I'll be around. But then help them to project this.
Put the main meters.
No, it's empty glass.
Again? Okay.
But it's picking up everything that was said.
No, because it's on audio. Yeah. He must be on microphone. Yeah. He muted. Yeah.
Okay, this one is full.
colleagues, funders, all the organizations we've invited. Thanks for making it to Kigali and back to the DSI Africa meeting. Welcome to Kigali. So we have had quite a few activities already as a warm-up, you can see. It's not moving. The next slide, please. Whatever hiccup. Yep, so we've had quite a few activities. We've already had a datathon, which has been a huge success according to the participants. We've also had 2 workshops and some fun activities for our early career scientists. So next slide, please. So I'd like to introduce our So there's some changes to our program. Thanks, David, for letting me know. Let me just get my notes. So we won't start with the VC. The VC has been elected the deputy VC, Françoise Tingera Katikada, but we won't start with her. We will start with the Executive Secretary of Rwanda National Council for Science, Eugene Mutimura. And we also have a replacement or representative replacing the Honorable Dr. Saban Azimina from the Rwanda Ministry. We will have Claude Muvini instead. And so now I will introduce our chair and co-chair. So the current steering committee chair is Professor David Tumasimi. So he's an associate professor, deputy director, EAC Regional Center of Excellence in the Biomedical Engineering and eHealth, College of Medicine and Health Sciences at the University of Rwanda. He's our current DSI Africa Steering Committee Chair, but he will be stepping down and handing over to Dr. Shenfeng Ziong. And Dr. Shenfeng Ziong is on a tenure track assistant professor in the Department of Civil and Environmental Engineering at Villanova University. He holds an MA degree in economics and a PhD degree in transportation engineering from the University of Maryland College. His research is focused on analysis, modeling, simulation of human mobility and travel behavior, and its wider applications to public health economics and the sustainability and the environment. He has published over 60 peer-reviewed journal articles and on these topics, and is also the recipient of the 2019 Outstanding Young Researcher Award of International Association of Public Transport. So I will hand over to our chairs to also offer their welcomes, and we can proceed with the program. Thank you so much.
Well, first of all, I want to say welcome everybody to this great annual meeting. Hope you all enjoyed today so far. I have a few activities at the very beginning just to give you a warm welcome. Can my colleague Francis pull up our activity slides? Technical issues, probably. Always happening. Oh, here we go. Well, I do this a lot with my students, but just as the warm up, I know we're all having our lunch and, sitting there hoping for coffee. But here is a QR code. Everybody, please take your cell phone or iPad, scan the QR code, trying to answer just one simple question. Where are you coming from? Where are you flying to this event from? Well, I'm just curious, like to see, who traveled the farthest here. Maybe I am. I'm traveling from Philadelphia area. Spent 24 hours yesterday And after maybe, 2-3 minutes, we will pop up a word cloud just to show you the results. So are you able to get into that questionnaire? Oh. Hope it's still working out. Yeah, I know the Wi-Fi has some problems, but it's just one question. I hope that's not too long. Oh, there are 3 boxes? Well, could be the country, province, and the city. My colleague Francis, would you be able to see the word cloud results now? You could start to show that. I believe people are starting to send in the information. Wow, great. We start to see results coming up. We got 94 responses so far. We got, see myself. Am I the winner? I'm not the winner, right? We have South Africa, United States as the keywords. We see Kenya. Where are Rwanda people? Well, United Kingdom. Well, we see a lot of places in this word cloud now. Are yours in this word cloud now? If not, I hope you're still able to send in some information into it. Well, my point is really, we have so many people coming from all the way around the world, in different corners of this world. We're traveling far to join this great event. We do it once in a year. We meet here, we meet each other, and to strengthen our existing collaborations, develop new collaboration opportunities, sparking new ideas, meeting new friends, and also, seek some adventures together. As the co-chair of this steering committee, I wish you all enjoy the meeting here. And I will be in touch and sending emails to you as the co-chair in the next year or so. So please stay in the lookout for more contacts and more information from me. A little bit more information about myself. I'm currently an assistant professor from the engineering school. I'm teaching civil engineering. In particularly, I'm doing transportation engineering per se. So it's about, building bridges, analyzing people's travel. And I'm doing also a lot of work in linking travel behavior, how people move, to the movements of diseases as well. So that's why I am here, trying to build more collaborations across these borders, from engineering to health to environmental science, so on and so forth. Well, yeah, so yeah, that's really my perspective. I wish we have more to discuss in the next several days. And also best wishes to all the events in this annual meeting. David, do you have anything to add to this?
Our guests of honor, distinguished guests, ladies and gentlemen, good afternoon. Good afternoon. Thank you. I want to take this opportunity as the chair of the steering committee of this Africa Consortium to welcome you all to this meeting, to the third DSI Consortium Networking Annual Meeting. You are most welcome. You are most welcome to Kigali. And again, I take this opportunity as the MPI of one of the projects that is research and training for data science for health in Rwanda, which is part of the consortium and which is co-hosting this meeting with the rest of the consortium, but also mainly with the coordinating center at the University of Cape Town. And with that, we want to thank and appreciate the efforts and energy used by the coordinating center led by Michelle to organize this important meeting. Please give her the. Having said that, I want also to thank you all for responding to our invitation. I know you received the invitation, which were co-signed myself as the chair, but also with the coordinator of the coordinating center. And we can see you have positively responded to our call and our invitation. Thank you for coming. And we want to thank everybody that has come from different corners of Africa, USA, and other regions of the world to meet here in Kigali and discuss what can make us progress in putting data science in use to help our communities get the best health care. That's one of the importance of the data science, but also the importance of the consortium. Just to tell you a little bit, some of you who might have joined or come to our meeting today, the DSI Africa Consortium started in 2021, but by then we had the biggest challenge of COVID. We couldn't meet physically, but we had our first meeting online. But thank God the COVID ended, and in 2022, we were able to meet for the second consortium annual networking meeting physically in Cape Town, and we were well received. We interacted physically, and we enjoyed the connecting and linking together. Now, 2023, Rwanda, we took the chance and opportunity to host the third networking annual meeting, and here we are. So let us use this opportunity of physical interaction, meeting together physically, enjoying. We've been seeing each other online sometimes, but now we are seeing each other physically, and we have to appreciate that. But again, we have to use that opportunity to make it fruitful in terms of discussing pertinent issues. This morning, we are discussing on how what we are meeting as challenges. We are learning from each other the best practices. So these are going to continue for the whole of this week. And us as the steering committee, we are happy again to still continue guiding the members of the consortium to the good line so as to achieve our goal as the consortium of DSI Africa. Having said that, and having had opportunity to host this meeting in Rwanda, we are going to hear from different speakers from the leadership. And allow me at this juncture, I will invite our Executive Secretary of the National Council for Science and Technology, who will give his opening remark. But before he comes on, allow me to say a little bit of his bio. The Executive Secretary of the National Council for Science and Technology in Rwanda is Dr. Eugene Mutimura. Dr. Eugene Mutimura is a Rwandan scientist and a researcher. He's currently, of course, the Executive Secretary of Rwanda's National Council for Science and Technology that is driving science and technology in the country, but also in the region. Prior to this position, he served as the Minister of Education of the Republic of Rwanda. And prior to this appointment as the Minister of Education, He coordinated 24 Eastern and Southern African Centers of Excellence programs, the project which was funded by the World Bank in 8 countries in Africa to support research and education in 16 universities. He also coordinated NIH IDEA-funded U54 grant that was for Rwanda, Burundi, and Cameroon. And also he is a recipient of the Fulbright Scholarship. He obtained his doctoral degree from the University of Witwatersrand, commonly WITS, in Johannesburg in South Africa in 2007, and previously worked at the Regional Alliance for Sustainable Development. So let us put our hands together to receive Dr. Mutimura. You are most welcome.
Thank you, David, for a warm welcome. Dear the leadership of DSI Africa, the leadership of various institutions in Africa, particularly public and private institutions in Rwanda that are present, ladies and gentlemen. I have the pleasure to welcome you all to this DSI Africa Consortium meeting that is taking place here in Kigali at Serena Hotel. Allow me to clearly indicate that this is an exciting moment for us as Africans, as Rwandans, as colleagues across the globe who are gathered here to look at how data can be clearly important to transform the lives of the citizens of our various countries. We know that implementation is based on policy. And I know many African countries have various policies on which implementation is leveraged. And therefore, let me clearly point out some of the important elements of Rwanda's policy on science, technology, and innovation. Rwandan policy on science, technology, and innovation is clearly important for us because it drives what we do in our country in various sectors. And for this matter, in terms of health, data is clearly important, and data-driven policy decisions are clearly important for us because they form a critical element of informing policy and practice in various fields. Our vision, therefore, is to leverage data to inform policy across all sectors with a focus on healthcare, improving healthcare system. Clearly, we know that use and application of emerging technologies, frontier technologies, are critically important. And so I give an example. More recently, we had a board or a council meeting on 19th October. And one of the resolutions of our council members or a board at the National Council for Science and Technology was to effectively examine data sector in Rwanda across the spectrum and see how we can develop a strategy to foster and use frontier technologies and innovations for socio-economic development. I'm happy to note that one of the council members is within the house in the audience, Dr. Birari Hakizumwami from Chicago University. And this Thursday, we are going to have a workshop to deliberate on how policies, strategies, programs, and activities can be utilized to look at how data can improve healthcare system in Rwanda. And so this is critically important because we will look at how various technologies, including AI, Internet of Things, and others, can be utilized in the case of data science to impact on healthcare system. Distinguished ladies and gentlemen, we are gathered here as various members from various countries. I note that there are 21 African countries participating in this consortium. I note that there are over 20 research projects, I think 7 research training programs, and more than 350 members of the consortium collaborating for 5 years and beyond. Let me say this is a critical moment to strengthen our collaborations now and beyond 5 years, because we need to work together to build excellence in data science, but also scale programs to impact on the well-being of the citizens of Africa and beyond. Let me clearly indicate that at the National Council for Science and Technology, we are going to advocate for availability of data for training purposes, but also for research in health sector and beyond, because this consortium is cross-cutting. Data accessibility is very important because it will help actually in the training, do research, but also in many ways. Effective data for science and innovation governance is important because it will entail establishment of robust framework for regulating research, promoting ethical practices, and incentivizing innovations. And we will continue to work with you and others to create an enabling environment to facilitate the use of data to foster excellence in research and healthcare delivery. Finally, let me point out something I feel that is very important on career path development. We know that we have always to provide opportunities to guide career path development of our trainees and those who are pursuing the field of data science for health. And therefore, we'll continuously work towards creating opportunities for career paths, incentivizing those involved and working in these fields in training and research, because developing clear career path is not only through incentives, but also making efforts to ensure that we improve healthcare data-driven innovations. Once again, I wish to welcome you all to Kigali, to this consortium, and we look forward to working with you now and in the future. I thank you.
Well, thank you very much, Dr. Mutimura, for your insights. We're excited to also kick off some innovations and collaborations on that. Well, now it's time, and my greatest honor to introduce you our next speaker, Dr. Peter Kiel-Marx. Dr. Kiel-Marx is Acting Director of the Fogarty International Center and Acting Associate Director for International Research at the National Institutes of Health. He joined Fogarty as Deputy Director in 2015 and assumed his current role on January 15, 2023. Dr. Kiel-Marx is an expert on infectious disease research and HIV/AIDS prevention. He held a variety of leadership positions at the CDC, including Senior Advisor to the Director of Health Reform and Chief of the Epidemiology Branch, both in the divisions of HIV and AIDS prevention. Without further ado, let's welcome Dr. Kiel-Marx.
Thank you, Chanfang, and I'm delighted to be here. It's great to be back in Rwanda that's been such a leader in some of these science and technology issues, and especially to be with this group, with our DSI Africa program. I've been following with great interest from NIH, from Bethesda, and this is the first time I've been able to actually come to the meeting and meet folks and see what you're doing firsthand. So I've got about a dozen slides here that I will get us through, if I can advance. I don't seem to be going anywhere. Could I have the next slide, please? Good. So I think most of you are familiar with NIH, but let's just briefly introduce ourselves. So the NIH is the largest funder of biomedical and behavioral health research in the world. And important to remember that it's a science and research agency. The first part of the mission is around the basic science and fundamental knowledge. And the second part is about the application of that knowledge to improve health. And remember, we're not a development agency. We're not a public health agency. We're a science agency. So that's our love language. What did you push? Okay, so I may need you to push it for me. It's not working for me. Oh, there it goes. Okay. And then the Fogarty International Center in particular, we're the smallest of the 27 institutes and centers at NIH. And we, with our resources, we support all of the other NIH institutes and centers and their global partnerships. And then we specifically focus on funding training and capacity building in lower income countries. This is our namesake, Congressman John Fogarty. Like me, he was a bow tie wearing Rhode Islander. So I'm happy to be at his center. But this quote really captures our mission, the expanding research and capacity building, and the partnership, the global partnership as a key part of that. So I'm going to make the case that NIH really is a global agency, and there's very strong scientific reasons to pursue that global research, the unique populations and disease presentations, and I've highlighted genetics here as an important area for our work in Africa in particular, but also you can see the rest of the list about unusual exposures, infections in particular, where it's important to collaborate globally, unique interventions, including some of what you're developing through this program, the insights of a diverse set of investigators, that all the best scientists certainly aren't in the US. We can learn a lot at the US from alternative health systems, and especially the early career researchers and trainees are very interested in global health. And we need these new tools to solve our global health problems, whether it's pandemic threats or the growing burden of NCDs or climate change in health. And just some data to back up this statement. So with Josh Grubbs, a postback a few years ago, we looked at all of the publications in PubMed that were funded by NIH and what percentage of those had a non-US affiliated co-author. We thought it would be 20% or so. It's actually 35% of all NIH-funded publications have a non-US affiliated co-author. So it's very much a global enterprise. And importantly, the second bullet, those publications that had both US and non-US co-authors had a higher scientific impact score than the US authored publications only. So there's a lot of it, and it's high impact. You can see if you're under 40 and don't need corrected vision, you can see on the left side, the number one country is actually China, which is kind of surprise or no surprise, depending on your familiarity with that situation. But there were over 7,000 publications a year funded by NIH with a Chinese affiliated co-author. The other countries are high-income countries in that group: the UK, Canada, Germany. And then on the right side, we have the lower income countries other than China, and that's Brazil, India, and South Africa, 800 publications per year with South African co-authors funded by the NIH. So this is showing for Africa, we have records of all of the extramural awards from the NIH. So in fiscal year 2022, there were over 1,300 extramural awards, collaborations funded by the NIH in 44 African countries. You can see the countries with the most awards were South Africa, Uganda, and Kenya. You can see Rwanda there on the list with 22 of these awards. So you can see, what I see is on the right-hand side, a lot of opportunity for growth and increased collaboration. Also important to note that out of these over 1,300 awards, 228 were direct awards to African research institutions. This is very important for having an equitable relationship of actually funding the Africans directly, so they're in the lead. And I'm happy that DSI Africa is part of that number, that 228. So this is now that same 1,300 plus awards. This is looking now by NIH Institute and Center. And you can see that probably not surprisingly, it's NIAID, infectious diseases, that's number one, followed by Fogarty, then mental health, child health, and cancer. But important to note, there's 24 NIH institutes and centers that have extramural funding, and 23 of them have funding in Africa. So please think broadly. Don't just think infectious diseases or cancer. Think about deafness and communication disorders and oral health and complementary and integrative health. It's really every part of NIH that's interested, that is collaborating in Africa and would be willing to do more. And the way we want to increasingly do this work, there's been a lot of discussion in the last few years about decolonization. And so at NIH, what we have is a working group on promoting equity in our global health research. There's 9 of the institutes and centers that are most active in global health that are part of this working group that Fogarty's helping to lead. We had a request for information last year and had 186 responses from both high-income countries and low and middle-income countries about this issue, which to us means there's a robust interest in this in the community, a lot of input from the community. The key themes that came out of this were inequity in the research partnerships, the funding limitations, the lack of capacity, the research priority setting, data access and ownership, which is of course key to this group, and then peer review, that the applications come from all over the world, but almost all of the peer reviewers are Americans looking at the science of the importance of the science in these applications. This is basically, you've heard about the golden rule. This is the other golden rule, that he who has the gold makes the rules. And the typical model is a U.S. investigator submits an application, U.S. peer reviewers say this is a good idea, they get the funding, then they approach their African colleagues and say, here's the money, here's the project, do you want to collaborate, yes or no? And that's just not a good model going forward. So we're very happy to have this program where we're directly funding the African investigators. You come up with the study questions and then collaborate with your US colleagues if they want to, but you're in the driver's seat with this program. So that's increasingly what we'd like to see. We've got a report that was published earlier this year about this. And we're carrying this forward with very active working group and subgroups looking at these different areas and how we can improve the situation from the NIH perspective. One of the metrics that we use is looking at the authorship of publications. So this was looking at all of the publications funded by Fogarty with a sub-Saharan African study matter. This is the mesh heading for the publication if there was a sub-Saharan African country as part of that. And we looked at the affiliations of the first authors and the last authors. And what we saw, this is with Ezene Akudinobi, who was an MPH grad leading this work, doing this work. What we saw over the decade, the red line there is the publications with a sub-Saharan African affiliated first author that grew considerably and is now more than the US affiliated first authors. Also, the green line is those with dual affiliation, sub-Saharan African and US. So that's now 63% of the Fogarty funded publications about Africa have an African affiliated first author. Last authors is lagging behind at about 47%. And the relative citation rate, the scientific impact of the papers with the African authors was lower than the papers with the American authors. So we see this as some indication of progress, but still more work to do to achieve equity in this area. There's also, you're probably aware, but want to make sure you all know about, there's the NIH has the Office of Data Science Strategy, ODSS. So at NIH, this is very much a focus. I'm now in the NIH directors meetings, and almost every meeting we're talking about data and data science and these issues. And I think some of these pillars will be very familiar to you in your work on data infrastructure, modernizing the data ecosystem, data management, analytics, and tools, the workforce development, a big focus, and the stewardship and sustainability also. So I would encourage you to take a look at this strategic plan. And there's a lot of resources, knowledge resources, but also funding from ODSS in these areas. And so just to close up and again, to come back to this program, this is an NIH Common Fund program, which means all of the NIH leadership identifies this as a key priority for NIH, harnessing data science for health discovery and innovation in Africa. In the first bullet there, I really want to emphasize the new partners from academic, government, and private sectors, and how it's been important for us all along to have the government involvement, which we're seeing, in the private sector involvement, both from the multinational private sector, but also at the local level, the telecoms and the others locally engaged. So it's been great to see that. There were the 19 awards in 2021, and then 19 more awards. So you've doubled your population just in the last year. But I'm well aware of this work going on, and just really happy to be here in person and see what you're doing up close. There's that last bullet is to emphasize there's 14 different NIH institutes and centers that are involved with this, many NIH staff who are here. So just to emphasize how, NIH-wide, cross NIH importance this program is for us. So just in closing, in summary, I think I've made the case that Fogarty and NIH really have very strong support for global health research and training, especially on data science. It's a big topic in the US and something that we're very keen to advance globally, and that we see equity, having equity in these research partnerships is critical to solving these scientific problems, and also for resilience. We saw with COVID, when there's an emergency, it's so critically important to have that research capacity in countries so they can lead their own responses. There's some information there for subscribing to our funding newsletter, our weekly funding newsletter, and social media. And then I'm just going to leave you with this QR code from ODSS to subscribe to their weekly newsletter if you're not already getting it. Just big thanks from me for the work that you're doing. Thanks to the NIH staff that are here and working so hard to support this. Thanks to the leadership of DSI Africa and all of you for the great work that you're doing. And we expect and are seeing great things from what you're doing. Thank you.
Well, thank you again, Dr. Kilmax, for your insights and succinct yet important keynotes. Well, I feel so informed about all the exciting things we're doing, including the publication numbers that's not only stable, but also increasing. We hope we are producing a lot more this year and next year during the DSI Africa Consortium. Then also interested to see your keywords on the last slides. You're mentioning about data science, but also mentioning and emphasizing the role of ethics. And talking about ethics, please allow me to introduce our next speaker, Dr. Nchangwi Mnang. Dr. Mnang is a bioethics researcher, and her research focuses on how theories of global health justice and African communitarian ethics could inform the equitable global governance of genomics and health research. She also works a lot in the ethics of infectious disease control and management, public engagement for genomics and data science in health, and ethical and social issues related to emerging biotechnologies. So let's give our welcome to our next speaker, Dr. Nchangwi Mnang.
Thanks, Chenfeng, and good afternoon, everyone. So my presentation will focus on the governance of data science and AI for global health, and divided it into two parts. The first on the governance of data science, and the second part will be the governance of AI and global health, where I'll just present some of the work that the Science Policy Engagement for Africa group, which is part of the Science for Africa Foundation, has been working on, and which we support in an advisory role. Can I please? Thanks. So in terms of the governance of data science in Africa, and I think this is an important aspect for all the projects here, with everyone thinking about how they will manage data sharing in ways that are legally acceptable, but also do it in a way that's responsible and ethically compliant. So one important aspect is the data protection laws. And if we look, there are many African countries that with data protection laws across Africa. So more than half of the African countries have data protection laws. Some are very new, like with Rwanda and Tanzania having being one of the countries that have just passed data protection laws. But we also have model data protection laws for economic blocks. So we have like the ECOWAS has model data protection laws, which actually just discusses or supports data sharing across the regional bloc. And then we have the Southern African Development Community also having a model data protection law, and then the African Union. And these data protection laws are in different languages and sometimes in two or more languages. But what I want to perhaps highlight here is that it's important to look at these laws also because sometimes in terms of cross-border sharing, when there is an adequate level of protection, then data sharing it's easier to manage data sharing. But one thing that's coming up is data sharing between African countries and European countries. And people are beginning to think, is it possible for researchers in European countries to share data with their collaborators in African countries? And much of the data protection laws are modeled in Africa, modeled around the GPDR. So perhaps that's something that you can look at when you think of sharing data with collaborators outside Africa. This slide is not very readable, but what I want to highlight here are the countries whose data protection laws specifically make reference to research. And we have Botswana, Gabon, Niger, Tunisia, Zambia, and then the ECOWAS regional bloc. And in terms of ethics, so there are specific provisions for research, especially for sharing genetic data for research. But the recommendations we want to highlight here from the ethics perspective, based on the provisions in the law, is whether we have to start thinking about introducing dynamic consent to support data-driven research, the need to support codes of conduct, and perhaps at this early stage, start thinking of harmonized codes of conduct across Africa that will enable us to share data seamlessly within the continent. So I already talked about the cross-border sharing of scientific data, and that there are three conditions that will inform cross-border sharing. If you look at the laws, it will be adequacy, the binding corporate agreements, and consent. And that is why, again, we are recommending the need to start thinking about dynamic consent and harmonized codes of conduct. But key for the governance of data science, it's not just the law. We have the ethics-based arguments. And so we looked at what principles are there, what are the principles that inform data protection laws across Africa. And you can see that from the word cloud. And then we looked at the ethics discourse on the governance of data sharing, and where you have the dark shade. So those are the principles that have, from the ethics discussions, are key for equitable sharing of data. And I think for us all is to say, how can we integrate ethics and the law to ensure that when we share data, it's not just for, we are not looking only at legal compliance, but to ensure that we do it in a way that's responsible and ethically compliant for the populations that the data is generated from. And the second part of this presentation is the governance of AI and global health in Africa, which focuses much on the work that the Science for Africa Foundation has been doing. And So basically, for those who do not know the Science for Africa Foundation, they are funded by the Wellcome Trust. And the Science Policy Engagement for Africa Research is an arm of the Science for Africa Foundation, and they're looking much around policies for data science and AI that could support global health in Africa. And so to inform their work, they've combined a number of methods to look at what's the policy landscape for AI and in global health. So they've done desk reviews, policy analysis, online surveys, and some of you may have completed these surveys. They've done regional convenings, and they have included 47 of the 55 African Union member states in these convenings. And what's coming up from the work they've done? So they engaged researchers, policymakers, civil society, the private sector, mainly commercial companies, and sort of identified what were the priorities for those working in the field of AI and data-driven research for health. So these are the priority areas that they identified from these consultations, but I have highlighted in yellow what's important for this presentation is that across all the different stakeholder groups, from the commercial companies to civil society and researchers, is the importance to mainstream ethics in all the work that we do for AI and data science. But then they highlighted the need for training in ethics, which was missing for so many of the stakeholder groups said they would need training in ethics or some form of ethics support. Many of the stakeholder groups said they were struggling with data sharing and data management, and they will need support. So the other priority areas are in terms of research. So I'm just highlighting what is relevant for ethics and governance. For the policy landscape across all the different regions, there was a lack of policy for AI in the field of health. So there were just general policies for AI, but very limited guidance in terms of health and health research. And so that is a gap that will need to be addressed across Africa. So what are the top ethics and regulatory challenges for AI implementation in Africa? So based on the consultations, there is a need for public education and engagement on AI. There is the need for buying. They've also highlighted that data sharing is increasingly becoming very difficult, especially with the data laws in place. Many people or many stakeholders or researchers are unsure of how to handle data sharing. There is a digital divide with data. There's limited funding to support AI work across the continent, and that is increasing that's creating an equity divide, and that the global north still is a dominant player, even for AI projects that are in Africa. A last priority area is the need for cultural sensitivity in AI research. So key findings from their work is the need for public education and engagement, the need to develop policies for AI and health specifically, and the need to fund and support research on AI, and to say also that besides the research, there is need to support governance, because the research is quite ahead of the governance, and there are concerns that it may lead to products that are not sort of culturally sensitive in here. So thanks so much.
Thanks so much, Nchangwi. And I think that we should really look back at that with the data governance working group. That'll be awesome. Thank you so much for that. So we're going to shift gears now back to DSI Africa, and I will present on an overview of the consortium, because there's lots of new members here, and we decided that just to, you know, go through the basics of the structure of the consortium and just a few updates and so on. So thank you so much. Oops. So this shows the structure of the DSI consortium with a coordinating center as a central part, supporting all the hubs and projects, engaging with whoever within those groups really want to work with the coordinating center on various cross-consortium activities. And we, of course, as a coordinating center, also support the working groups. We are physically quite close to the Alwazia ODSP. We're in the same building. And of course, we're part of the same project. And we work very closely to coordinate various activities, especially around training, data management, and so on. We also support steering committee. And as you can see, we work very closely with the NIH staff. All the NIH program staff on the DSI Africa project is currently at the meeting and working with us to support the consortium. And in future, if there is a need to convene advisory committees, we as the coordinating center, of course, can support that. Yeah, I'm just sharing the map of the footprint of DSI in Africa. I think it actually needs to be updated. 19 projects have been added to the consortium, so that brings it to 38, and we're in 21 countries. And of course, you can see that additional areas of interest research have been added, like pathogen surveillance, risk prediction, polygenic risk scores, zoonosis, and so on, as well as congenital health disease, colorectal cancer, and developmental disorders. So we really do welcome those new projects, and I'll get to some of those slides later as well. So this is an infographic just showing some key information. As I said, 38 projects, over 350 members. The coordinating center has also supported over 100 travel awardees to these meetings and actually to other network meetings around the globe. And we're very happy to do that as well. So this shows the ecosystem of the tools, the software, and all the tools that we use within the consortium, and recently added to that through the funding through one of the new projects. We add synthetic data training, the use of synthetic data, and there's a lot of discussion, of course, around that and how it can support research and sort of overcome those ethics and legal issues that folks are having, really struggling with. So this shows the Alwazia ODSP. Of course, we're based in South Africa, but it's actually a network within the project itself. And we are really there to support the consortium and to build the data science community. And of course, the ODSP is there to support all things data, access to tools, workflows, and of course, especially for those activities for cross-consortium collaborations to support that. So the research hubs, these are multidisciplinary projects having an academic component, an industry partner potentially, and also government. So really to take those data science discoveries and have an impact in policy and healthcare systems. The LC projects, and we will share these infographics. We've printed some of them, so you'll get these, and you can, of course, get the slides as well. So the LC projects have our experts in ethics and law, and they really support and advise the consortium, especially the research hubs, on the issues around the law and ethics with the data sharing. But they also do a lot of stakeholder engagement with the folks that, the participants perhaps that are impacted by the research. So our research training hubs, they are training the faculty in data science and are actually, it's a really big part of sustainability, as they also train the upcoming data scientists, which is building capacity on the continent. And now the new projects shown here, the research projects, so they have niche research questions. And as I mentioned before, they're covering bringing a lot more diversity to the project, including around pediatric HIV, complex variant analysis, early early risk prediction and colorectal cancer and so on. And I'm sure you're going to meet many of these folks throughout the meeting. And then the research education projects, of course, focusing on specific research, training needs that have been identified within the consortium. This is showing some collaborations already within the consortium. The team is working on this. Tino and Francis connecting the dots between projects. And as you can see, Uzima is quite busy connecting with everyone, Alwazi. And then the red dots are the LC projects. So they also connected to various, the green dots to various research hubs. So we got some feedback today in the partnerships and outreach groups. I think the IBM group suggested that we create an organogram and especially highlighting the pilot projects. And we can see how projects are connected, who's doing what, and that will actually facilitate collaboration. So we already want to work on that as well. So just some of the meetings that happens regularly throughout the year. Within 1 month, we'll have a steering committee meeting starting at the beginning of the month, and we have our various working group meetings, the training and education, data governance, partnerships and outreach, data management. We also host 2 online biannual network exchanges. We host 1 in-person network exchange, and of course this consortium meeting. We also got a lot of feedback today from the partnerships group on how to improve and sort of meet people's needs within those platforms, and that's really great. But we also need folks to volunteer to help us as facilitators during these things, and also just give us feedback all the time and work with us. So you've met our chairs, and I just wanted to say something about the steering committee. So the purpose of the steering committee is really to provide leadership, guidance, strategic oversight to advance data science research, collaboration, and capacity building initiatives across the African continent. The committee is also responsible for shaping the consortium's vision, setting priorities, and ensuring effective realization of our goals. So we also use the steering committee forum to do regular updates. Here you can see we're meeting mostly online, and it's quite well attended. This is showing the Uzima network, and they're linking out, collaborating with folks. It's quite impressive, and the attendance is quite good for steering committee, and we should keep it up. And I think obviously it will be more now because we've got new projects coming on board. So we use this for project updates, working group updates, and then just sort of general housekeeping just to keep connected. So I'm just going to mention the background of the various working groups. You'll interact with the working groups this week, so I'm not going to go into all the details. Just want to keep up with time. So the data management working group met earlier today, and was actually a good meeting. Folks met online as well. I think the chair joined online. So it aims to provide resources, data standards, and training in coordination with other working groups. Notable activities include hosting webinars and presentations and highlighting best practices for data management. The partnerships group also met today. So this group really supports the DSI initiative and goals of enhancing and impacting data science in Africa and spurring innovation through support of new African and global collaborations. So this just shows the membership, and I just wanted to highlight here that this group is open to external members. You can see there, it's currently got 150 members, and 37% of that is external. So that's open to everyone. And as you see, we've hosted a number of events. We've reached over 1,000 people, and it's been going quite well. We've also reached out to other organizations like Deep Learning Indaba X, Data Science Africa. We attended some workshops and datathons. So that was really quite a learning experience. This is the training working group. We see they meeting online about competencies and developing their own competencies for the Introduction to Data Science course that they're working together on. So their main activities are to coordinate cross-consortium training activities. And for this, I think it's very important for the training groups, for the research hubs, and the new training projects as well, really to talk to this group, use it to amplify your training, use it to advertise your training. Someone was saying today in the meeting that the training projects are not meeting, they're not networking, but this is a platform for those folks to meet, and please use it. It's a resource. We have facilitators, we have chairs, we meet monthly, and you really need to participate in this, and that's space for those training groups to collaborate. So this is just the plan for the competency mapping. I won't go through it, but they have a plan, and I think they want to have a product by next year. So the data governance group will meet tomorrow, and we will have a look at the draft of our data governance and sharing policy. Also, please come to that meeting, participate, have your say. We really want to hear from everyone because it's going to affect your project, is going to affect your data sharing, and then the data sharing across the consortium as well. Just some resources that we use. We use Active Collab to host our various working group agendas, minutes, and we disseminate emails from here. We are onboarding the new projects, and of course we need to know who those members are. So please share that with Tino and Francis. That's just one of the resources we use. We also use a lot of RedCap. We do a lot of surveys on RedCap. And also we offered some training. So Francis mentioned in the Partnerships and Outreach Working Group that we were launching a DSI Consortium tagline competition. We would like folks to participate in this. So what we're trying to achieve here is, our goal is really to create a memorable and inspiring tagline that encapsulates our collective vision and mission, highlighting our commitment to addressing critical health issues through data science and related disciplines. So we invite the consortium members to participate in this, as well as the Partnerships and Outreach Working Group members that are not consortium members. So this is the nitty-gritty. So we basically want a tagline of about 10 or less words to capture the essence of the consortium, of course. This will be judged, and there are, of course, prizes involved. So it's something like, like Nike has Just Do It. So we want something like that will be branded with all our branding. So please do make your submissions. We do have a QR code there. We're going to share it at the networking exchange as well. So please make your submissions, and you could win a prize, and you could have your tag on all our branding. So that brings me to the end, just to thank the team. And yep, you'll see them running around here like meerkats. So yeah, I'm going to hand over to Nikki now. So I'm going to introduce Nikki. So Prof. Mulder heads the Computational Biology Division at the University of Cape Town and leads the HRA BioNet, which is a Pan-African bioinformatics network across 17 countries. It develops bioinformatics capacity to enable genomic data analysis in Africa. But she also leads the Harnessing Data Science for Health in Africa Open Data Science platform, and previously worked at the European Bioinformatics Institute in Cambridge as a team leader. At UCT, her research focuses on genetic determinants of susceptibility of disease, the African genome variation, microbial genomics, and infectious disease. So a group provides the bioinformatics services, develops for the analysis of complex African genetic data. She's actively involved in bioinformatics capacity development globally, and sits on a number of international advisory boards. So thanks, Nikki, and over to you.
Thanks, Michelle. Thank you for the introduction. So I also would like to, just on behalf of the Alwazi Consortium, welcome all the new projects to the consortium, to the DSI Consortium. So Alwazi is a consortium in itself. Actually, we have 11 partners in total. So 7 of them were from the original HRA BioNet consortium, and then we've got additional partners in the USA and in the UK. So when I talk in this talk about we did this, we're going to do that. It's this collective we, because everybody's made a great contribution, and so have the DSI Africa projects. So just to provide an overview of the Alwazi ODSP, so I'm going to talk in a bit more detail about the part that's in the dotted lines. That's the platform itself. But just to say that, yes, we are all about the data, but we're also about providing other kinds of support. So we want to provide support generally related to data tools and compute. Think about how we can implement the strategy and the needs coming out of the data management working group. Facilitate implementation of what comes out of the data governance working group. How do we implement the security and the authentication and authorization when it comes to access to data? But we also have, through HRA we've had more than a decade of experience in training in Africa in resource-limited settings, using unique models for training, thinking about competencies. We've been working a lot in the area of bioinformatics competencies. So we're also very happy to support anything on the data science training side of things as well. And also hosting SOPs, hosting portals, hosting documentation. So now to dive a little bit deeper into what is the Open Data Science Platform. So all the research projects will have their individual data sets. They might be sitting in various different cloud buckets. They might be sitting in your local HPC, or they might be sitting under your desk in in your computer only. You also will have a set of tools that you want to work with. Hopefully they'll be sitting in some sort of repository like DocStore, but they could also be sitting on your desk. So what we want to have is that all your data sets are indexed in some sort of registry so that they can be found. We want to have provide support for you to harmonize your data sets. So there's the data sets that you within a project will be collecting as your project. You'll be collecting and harmonizing data sets for your own projects. But then downstream to that, there'll be hopefully harmonization and meta-analysis or the opportunities for cross-consortium analysis of those derived data sets. So there's harmonization and data integration at many different levels. And we also want to then harmonize and integrate the metadata so that we can put that into a catalog so that the whole of DSI Africa data sets are fair. They're findable, accessible, interoperable, and reusable. So what this means is that you as an LYZ member, as a DSI member, can come into the LYZ workspace, find through the catalog, find whatever data sets you need to find within your project or within other people's projects, look at what the access requirements are, go through the various data governance issues that you need to go through, access these data via this data registry, pick the tools that you want to use to analyze these data sets, and then execute your analysis on whatever computing environment that you want to choose. So for this, we wanted to get something up and running very quickly. So we've got two implementations. We've got a Terra implementation and a Gen 3 implementation. So the difference between these is simply where you're going to have your data stored and where you're going to compute. So the Terra implementation uses the Google Cloud Platform and are working. I think they're probably very soon up and running on Azure as well. And there you can go into these workspaces. So you can create a workspace for your research project or your research hub, put your data sets there, call them up and do analysis on them. So you can actually extract them and do this all in a collaborative environment. And then the Gen 3 version is simply if you want to have a similar environment, but you're doing it on Amazon Web Services because your data happens to be stored on AWS. So those are the two implementations. But now what we're trying to do, and I'm dividing the rest of this sort of talk into our working group structure, is think about how we can make this a bit more flexible, because we've heard there's not hesitation to use the cloud, but there are issues around using cloud. There's costs, there are concerns about security. Not everybody knows how to use it, access, etc. So we want to have flexibility to manage the data as much as possible. So if you have some data sets on AWS, your other partners got data sets on GCP, and your data sets are sitting in your HPC. How do we manage that you can actually access those data sets without having to move them all to one place? And so what we're doing is working with the Global Alliance for Genomics and Health. All of these, Terra, Gen 3, they all implement GA4GH standards. And these are just technical standards to enable data finding, tool finding, and federated computing, all within a responsible authorization and authentication infrastructure, so the AAI. And so we've got the starter kits from GA4GH. We've actually implemented them on ILIFU, which is a cluster at UCT that we share with the astronomers. And here we've been using this to test some of these individual components, the data registry service, for example, how we implement the security, the authentication authorization, and which we've developed a template for actually rolling these out to the ACE centers in Mali and Uganda. And so what the group has started to do through a GA4GH workshop is think about how we can have a pilot project where you can have data stored at different places, but you can still compute on all that data. So in this case, they took 1,000 genomes data. So it's genomic data that took the ACE2 gene, that region, divided this into 4 pieces, one sitting at each of 4 different locations. And then you can now query those data sets through a Data Connect, which is just a technical way to search these data sets, and then actually run federated analysis. So you use this Connect server to see where are these data sets sitting. It tells you they're sitting at these 4 different locations. You send your tool to the one location, you do the compute you need to do, and you get the results. And then you send it to the other one and you get the results. So you pull all the results together, and then you can combine this and get some sort of combined federated analysis, and those data sets themselves never had to move. So this is a pilot implementation that we're working on, and we want to get to is the point where you can actually, you're agnostic to where those data sets are sitting, and this may help where you have issues around data sets having to cross borders. So the data set doesn't cross the borders, you visit the data and you pull the results, and then you can do your analysis. So we're working on that, and it's actually something that is not really globally done yet. So we're working with DNS Stack, which is one company that has done it. So hopefully we can help to lead the way in this, particularly taking into account the needs of low and middle income countries and the context, African context, and what the African researchers want. So that's the kind of the basic skeleton infrastructure we're working on. The tools and workflows group have also been working very hard. So they're implementing a lot of their projects on Terra. So they've organized a billing project. So we have an Alwazi billing project. So if you want to test some things out on Google Cloud Platform or Azure, you can come and use the Alwazi one for small ones. We haven't got a huge bill. And so you can add team members and play in this area, create a Terra workspace. And so we've onboarded various projects. We've onboarded Inform Africa, and they ran a distributed sort of Africa-wide analysis for a science paper, and we've tried to replicate that to make sure that we can actually, to demonstrate that we can do this through a Terra interface. So we've also run various seminars and work and events. So we've run some seminars on Terra and how to use Terra, and this has hopefully increased the proficiency in using that platform. We've run some a hands-on seminar on Gen 3 as well, so that is also more accessible. And then in August this year, we ran a workflows, containerization and workflows course. And that was together with the Mediva project. And that was to try to build skills, not only in Alwazi, but also in the DS Africa projects, in how to create your own containers and workflows. And this makes it much easier to deploy these on various computing environments. And so we've hopefully built skills and a community of practice. We've built a community of practice now around Nextflow and Terra and using these workflows. And then the Datathon, which ran yesterday, you heard I think a little bit about earlier today. And again, Terra was used as the platform for that. Can you make it work again, please? Okay, so data support. So a lot of the work and engagement so far has been in the data support working group. They've been very active. So the aim of this support of this working group is to enable greater data use across the DSI projects. So to enable the research hubs to pull the data sets together that they need to pull together for their analysis, but then also downstream to think about how the additional projects, other projects can use each other's data sets. And so there are 4 main components under the data support group. We are looking at FAIR, making the projects fair, defining the requirements for data sharing and reuse across the consortium. And that's together, we're hoping to implement, obviously, what the data governance working group is going to develop, facilitate the harmonization and integration of data sets, and then build this browsable catalog. So it really requires a lot of engagement with the DSI projects. Many of them have been very engaging and have attended the workshops. Not all have, but it doesn't matter because it's not a requirement to do this. It's something we want to support. So if you need our help, we're more than willing to have you contact us and work with us. So we've had a few meetings throughout the year to get an overview of the data types, to think about the data challenges and needs, and to build these fair maturity models for each of the projects. And so we've also been invited to and participated in some of the DMAC meetings that you guys have held. So the FAIR project, this is findable, accessible, interoperable, and reusable. Actually, Peter talked about FAIR, and we're hoping that we can help to implement FAIR in these projects. And so we've established FAIR goals for the DSI Africa project. What are the needs for aggregating and sharing data and building these maturity models? And so one of the things that has happened is we've got these maturity models and things that we want to work towards. We've also taken all the different data sets and the data use agreements and helped the projects to think about how we can map these to the data use ontology, so that at least it's very clear what each data set can be used for. One of the challenges that's come out of that is distinguishing between primary and transformed data. At what point does the data no longer get governed by the original data access agreements? And so that's a big thing for the data governance group to be hopefully solving tomorrow. On the data harmonization, this is obviously a big challenge. We've heard several times today the mention, particularly in the data management working group, about what a big challenge this is. So the aim here is to support the DSI projects with data harmonization, to develop a data harmonization toolkit, and to provide guidelines and training and recommended standards. And so we've been working data harmonization actually through other projects, so the Seneca project, through H Africa, etc. And so we have been looking at how we've actually built some data harmonization algorithms, but the projects here, as you saw from Michelle, they were diverse as we started. Now with 13 more projects, they're even more diverse. So the data, you can't just map to one data model necessarily. So there's a lot of extra issues to address in these projects. Some models exist, some have to be adapted, some have to be recreated. So the HEAT project has developed this metadata matching tool, and so we're helping to support dissemination of that to get other people using that. Once you've done that, to have this data transformation, so to build data transformation algorithms and being able to identify where that worked or where that didn't work. Applying different data models, so OMOP seems to be the most talked about one so far, but that's only for clinical data. There are many other data types here which are going to need models. How can we provide support for that and training on that? And then these data harmonization guidelines. So there isn't going to be one size fits all, but can we develop something that at least people can start with and then adapt to individual needs? Again, one of the challenges here is free text value harmonization, but there are many challenges. So it's not just about particular data types. It's really about not just harmonizing the metadata, but harmonizing the actual data within the data sets. And then the other project on the data support group is the catalog. So the aim here is to enable browsing so that if somebody comes in as an outside of the consortium, they want to go, what is this DSI consortium thing all about? They can find all the different data types, different data sets that people are working on. It doesn't mean they have access to those data sets, but there's clear information about what is the access requirement for that data set, which is a DSI data set, which is now a derived data set, and what are the access requirements for that, and how can we put those all together? It's really about sort of finding what is there within the consortium. And so we have this prototype up where you have just a few fields that can be filtered for each project, what kind of data they're collecting. So this is very high level metadata, but now we're going deeper now into being able to filter at a much more granular level, because this is very high level in terms of what the different projects are collecting. And can we do this for each of the individual data sets within each of these projects? So there's a lot of development happening on the catalog. So the outcomes that are desired for the data project is these fair maturity assessments, getting all the projects to as fair as possible, as fair a level as possible, harmonization pipelines, looking at the data governance policies and making sure that anything we need to do, like mapping to Duo, is done, completing the catalog and upgrading that to make it much more user-friendly and much more comprehensive. Provide OMOP training. And then, of course, now there's 13 new projects that we would love to engage with and see if there's any support you need and if we can bring those data sets in as well. So then the last working group is training and outreach. So we've run 4 major events. The research data management workshop is actually an HRBINet workshop, but since HRBINet is ending now, this will move into DSI Africa. So it's a workshop covering many different aspects of research data management. It runs online in remote cluster model. But we've run 3 face-to-face events, the GA4GH technical implementation one in June, the catalog jamboree, and then this containers and workflows course workshop. So just in terms of numbers, because these 3 face-to-face ones being face-to-face and they're quite intense in terms of interaction, we can't take more than about 25 to 30 people. So it ranges from 20 to 28 people. Many different countries represented, many of the different DSI projects represented. So there's obviously a big spike in Alwazi ODSP because the GA4GH workshop was particularly for upskilling the Alwazi folk to be able to support everybody else. But you can see that all the other projects have participated to some extent, even the training groups. And then countries represented, again, South Africa is highly represented. All the workshops were all there this year, but many other countries have been represented as well. So we hope to be able to support the consortium in many different ways, some that we've done already, some that we're still hoping to do. We need to do a lot of more further engagement. We can support on data, storing, serving metadata, developing data models, helping with data harmonization, tools, helping you to containerize workflows if you haven't already done that, developing and adapting new tools. We've got a group from Mauritius who's got a lot of experience in machine learning. There's a lot of expertise across Alwazi, but also then, bringing in your expertise and working together. Let's have a consortium-wide software group, best practices group, and these communities that we don't work in silos. And computing, hopefully we can help to facilitate onboarding you onto these various cloud platforms, and easing the access to compute facilities, even finding your play area that you can go and test your algorithms before you then create a massive account on one of these cloud platforms, or if you want to compute locally. That's what we're building the infrastructure for, to give you the flexibility. And then training, we've, as I said, got a lot of experience in curriculum development. We can host training materials, we can run training, and we at the moment, we're running training directly related to Alwazi, but we work obviously closely with the coordinating center on the general data science training. And so we can host all these different things. So the website is available, which provides a link to all of these different resources. And we have a help desk where you can ask any question, anything, if you need any support, from one very quick question to a full-on, I need to integrate 20 data sets, please help. And there are different categories there that you can select, and then we will engage with you directly to provide support. So a lot of this is done through the working groups. I mentioned these, the four there. Those are the working group chairs and co-chairs. We've also got a monitoring and sustainability working group to think about sustainability in the future. But we want you guys to join the working group. So we do a lot of work with sort of the detailed technical work in there. And you guys, a lot of you, your DMAX, for example, have a lot of expertise in this. So we'd love you guys to join. There's a sign-up form, RedCap sign-up form to join the working groups and to get involved. We want to co-create this. Just some useful links. The slides will be shared. So if you want to get hold of those links. And so I just want to acknowledge the whole consortium, the working group and the working group chairs, and also obviously to our funders from the NIH. So thank you for your attention.
Thank you, Nicola, for telling us all about Alwazi, one of the best platforms that is connecting us as a consortium. And I think there is a lot. And not sure if anyone who wants on Thursday, I think there is a booked session with Alwazi if we want to be in and get details of how to use it. I hope people have already booked, but it's a good knowledge to obtain as we work through this consortium. Thank you very much. And again, I want to thank Michelle for updating us on the consortium, taking us through all the activities, what they are doing. And I think it was very, very important for us, but also most importantly for our leadership that is here. Sometimes they see us coming to them, asking for letters of support when we're applying or doing something else. But sometimes we don't take time to explain to them, but they know that we are doing good things. And I think the coordinating center has explained, has showed some of the details, and we are happy for that. And thank you very much. And having said that, we are going to enter again into welcoming a speech from one of the leaders of the University of Rwanda. And as I said from the start, the University of Rwanda, we are taking this opportunity to host you here, co-hosting with the coordinating center. And we are going to receive the DVC, that is Deputy Vice Chancellor in charge of finance, representing the Vice Chancellor. But we are privileged to have such a person who usually manages and leads our finances at the university. The University of Rwanda is one of the biggest public institutions in Rwanda. It has a population of over 35,000. There are lots of projects, a lots of funds, but this is a good time for us to join us, and I think this was opportunity. So I will welcome Mrs. Françoise Tengera Kaitali, the DVC of the University of Rwanda. Thank you, Françoise. You're most welcome.
Thank you very much, Professor David, for the introduction. So my remarks are going to be the ones that were supposed to be delivered by our Vice Chancellor, who couldn't make it this afternoon. So I'm in his capacity, not the person in charge of finance. Thank you, though, for the introduction. To our guest of honor, Director General for Rwanda Biomedical Center, who is representing the Minister of Health, the National for Science and Technology Executive Secretary, Dr. Peter Karamax, Director of Faculty International Center at NIH, to Professor Nicola, who has just presented, DSI Africa leadership, DSI members, all the consortium members, colleagues from different universities around the globe, colleagues from University of Rwanda, ladies and gentlemen, again, very good afternoon. On behalf of the Vice Chancellor of the University of Rwanda, it is with great pleasure that we welcome you all to this meeting. The University of Rwanda is honored to co-host the third DSI Africa Consortium annual meeting, networking meeting, and as a university, we are a proud member of this consortium. We thank you all, dear participants, who came all the way from different corners of the globe to participate to this important meeting. At the University of Rwanda, we are proud to be the most comprehensive university, a public university in Rwanda, where our academic staff and researchers work together with the international researchers to do research and they look for solutions to the communities with the most pressing issues through generating evidences to guide the policies and practices. In this line, University of Rwanda researchers in partnership with others were able to obtain the grant from NIH and be part of this wonderful consortium that is working to use data science for health in Africa with the goal to improve the health of the people on this continent. Being in the consortium, University of Rwanda has an advantage to serve and contribute to the development of the country and Africa in general. It is therefore our privilege to be the implementer of the research training in data science for health in Rwanda project, which is among the projects of DSI Africa Consortium. We would like to thank particularly our Center of Excellence in Biomedical Engineering and eHealth, one of our 9 centers of excellence at the University of Rwanda, where this project is based. And now we have also obtained an additional sister project regarding the use of synthetic data. So having said that, I would like to particularly thank the funder, US, NIH, for this funding and financial support. Ladies and gentlemen, it is again our privilege to co-host this meeting of such key experts in data science, mainly looking at research and training. Research and training are among the 3 fundamental missions of the University of Rwanda, the third one being community engagement. we are committed to pursue our mandate towards capacity building for the human resource in the country and conducting impactful research to provide evidence and guide decision-making and policies. We believe that the exchange of ideas at the third DSI Africa networking meeting will not only significantly contribute to the discussions and the opportunities in data science for health in Rwanda, but also will foster partnerships for research and training to develop experts who can always get solutions to the most pressing matters for health in line with the different countries' visions, the region, and Africa at large. The University of Rwanda is highly committed to the partnership to support its researchers and trainers and is looking forward to enhance this collaboration in research training in data science for health. So once again, thank you so much for all the participants, and we're looking forward to have you for the whole week. Please, this is my personal request, take time also to visit different interesting parts of Kigali. We have a beautiful country that can offer quite a lot. Thank you so much. And once again, thank you for your kind attention.
Thank you very much, DVC. Now, allow me to take this privilege again to introduce our guest of honor, Professor Claude Muvunyi. Professor Claude Muvunyi is the Director General of Rwanda Biomedical Center. And most of you know that Rwanda Biomedical Center is the institution that implements all activities of the Ministry of Health. He has more than 10 years of technical, managerial, and strategic experience and expertise in the field of clinical and public laboratory medicine with a special focus on clinical microbiology, laboratory systems, and service strengthening, and global health security. Professor Claude Muvunyi is currently a full professor of clinical microbiology and laboratory medicine. He holds a degree in general medicine from the University of Rwanda, specialization, and a PhD in clinical microbiology from the University of Ghent, Belgium. He also holds a master's in medical virology from the University of Manchester. You are most welcome, Professor Claude.
So thank you very much, Prof. David, for this nice introduction. Again, distinguished guests and the members of DSI Africa Consortium, ladies and gentlemen, good afternoon. Good afternoon. I hope that you, even though you are in the mid of this long days of workshop discussion, I hope that we'll be keeping that commitment until the end of this workshop or training. So again, I'm here wearing different hats because first of all, as Prof. David mentioned, I'm the Director General for Rwanda Biomedical Center, which is one of the main implementing agencies of Rwanda under the Ministry of Health. I'm here, I think I'm really grateful because that institution has really emerged or has really strengthened the way we implement health interventions. But as recent, we really thought that data science could be one of the areas where we could, first of all, build capacity, but use it to really inform our policies, and also our interventions. So again, we had the brilliant idea of creating programs, divisions, which is among the 15 divisions that is under Rwanda Biomedical Center to implement data, innovation, and sciences to really make sure that our programs, HIV, TB, malaria, NCD, and so on, use data to really sustain the gains, but also identifying critical or targeted interventions to really fill the gaps and improve the health of our communities. Secondly, I'm also here as a researcher and also as a professor at universities where I think collaborations between health institutions and universities is one of the examples that I think we want to show and make sure that we really use that collaborations and partnership to make sure that these kind of projects or consortiums is really gaining its impact in all we are doing. Again, last but not least, I'm here representing the Minister of Health, who could not be with us. I think he would really wish to be here, because of his personal interest in data, but also as the Minister of Health, to really be together with you as a host country, but also a host institution. So again, on behalf of the government of Rwanda, I think it's really a great pleasure to welcome you all in Rwanda, and really to thank you all for taking the time to travel and be in Rwanda for this third DSI Africa consortiums to really discuss on how we use data for the data for innovation and also for really some discoveries in health in Africa. I think also this is something Rwanda is eager and committed to use. Some of the things that you are presenting this morning, or the beginning of this afternoon, as a sense that we use, we are really keen and committed to using technology and innovations as tool to drive health systems to deliver the best healthcare and also boost the rest of the economy development. Again, if you took the example of the experience of dealing with COVID-19, we can really clearly show you that we need to learn from those experiences where we use technologies, data to really inform all our interventions, all our measures as we continue to fight or respond against COVID. And then as of now, we think that we need to probably dedicate our focus, our investments, and our commitment to data to really prepare ourselves very well to any pandemic. And I'm really glad to hear that there are also a lot of mechanisms in place to allow more research grants toward this kind of area or scope, but also other areas of really making sure that we share those data with transparencies, but also making sure that also we protect the privacy of the data ownership. So this is really something I think Rwanda will continue to support. And so we know that the use of data science and science for health really comes at the right time when we need it, and to really make sure that we are really ready to build that capacity to use data in our interventions. And to show that Rwanda is really also aligned with this importance that we give to data, we have really been able to initiate a lot of projects in healthcare that again require the knowledge and also skills of data scientists. So I think some of those initiatives are, for example, the ICAD Africa, which is another center which is focusing on research on minimal invasive surgery, but also making sure that artificial intelligence and also data science scientists are really used to be able to train surgeons, but also do research on some of the high level technology like robotics to support surgery. We also have another initiative like BioNTech, which is going to really boost and then probably localize the manufacturing of some products like vaccines, diagnostic, and therapeutics in Africa, where we need most of them. And then this is again another areas for researchers in Africa to prepare ahead of time those biomedical data that I think is going to really be available, but also used by manufacturing in terms of really planning where to focus our innovations or interventions in terms of vaccines, but also making sure that we are really designing solutions that is really relevant and also a context in the context of Africa. Again, I'm not sure also you're aware of African Medical Agency, which is going to be another areas of regulations, which I think is very needed in whatever we are doing in terms of making sure we build this manufacturing ecosystem in Africa and also specifically in Rwanda. So again, we all believe that the use of data science will move faster. All those technologies which are required, such as the use of artificial intelligence that we just heard about it, and also other technologies. So again, I therefore thank all the initiators of this great idea of building capacity in our people in data science for health, which is, I think, is really another very key areas to use for Rwanda, but also in the regions. Again, I also want to express our gratitude from the government of Rwanda to the US government, to the NIH for providing the fundings to our institutions like University of Rwanda, and also to the government in general, and also to make sure that we have this wonderful consortium which is working to use data science for health in Africa, and also with the ultimate goal of improving the health of people. So we have, I think the DVC of Finance mentioned about University of Rwanda being part of the consortiums, but I also know that Rwanda Biomedical Center and also with other research organization in Rwanda is also part of the research hubs, which is one of the research grant which calls CAMRA, Combating Antimicrobial Resistance in Africa using data, which I think are also part of that consortium. So again, I think this is a really good opportunity for Rwanda and also other research organizations and universities which are in the consortiums to continue to meet, reflect, and discuss on these pertinent challenges, but also opportunities that we have in terms of building the capacity in using data to really get to some discovery, but also some good innovations in health. So again, my task was very easy to welcome you in this for this consortium. And on behalf of the government of Rwanda and the Minister of Health, I'd like again once more to thank you very much for being here, for travel from your respective destinations, be here in Kigali, and I wish you fruitful deliberation and discussions, and we hope that we'll have more opportunities where these particular topics of data use is really more emphasized, so that we really manage to build a resilient system to respond to pandemics, but also continue to really sustain the gains that we have achieved in controlling all the infectious disease, and also, last but not least, making sure that we really build that partnerships between universities, such institutions, policymakers in head. Again, thank you very much, and enjoy the rest of the afternoon.
Thank you very much, Professor Muvunyi, and also represented the Minister of Health. And I think members, we are now officially welcome to Kigali, Rwanda, all the time. And please feel free, interact. And as DVC said, visit Rwanda. It's a lovely place, explore and take this chance. So I think we're almost coming towards the end of this session, but I want to invite again the coordinating center to tell us the next. Thank you. Thank you, everyone.
Thanks so much, David. So some of our guests will leave us now, or they can stay on for the networking exchange happening at 5:30. There's some tea available now, but I would say to the projects, the PIs, going to the steering committee meeting, grab some tea, and let's meet in the auditorium. We meet for 1.5 hours amongst ourselves, and then the funders join us. I think it is at 4:30. And we can chat with the funders as well. You can also come back to this room once you grab your tea, and Francis will take you through the ideathon. Those are the folks that are not going to the steering committee meeting. So thank you once again for your attention, and I hope you enjoyed the opening session and enjoy the rest of the week. So we'll go to the next meeting. Thank you so much.